Okay, so we're gonna pick back up, with chapter 15, vital signs. We're going to lecture for about 30-ish minutes, and then we'll take some time to practice checking, someone's pulse and blood pressure. Because our next practicum is going to be over vital signs.
Do we have to do that?
Even though you don't use it as a test.
And you gonna check us out and, project this, whatever, for this, or we gotta do that at our sites? Cause it's, I think it's only.
We have to comp in sterile field and stuff like that, right?
Y'all put our
I did that
CPR
yesterday.
in.
Did you get the
Y'all put our
I think so.
CPR in.
I told my coach. I opened the sterile field and did all that stuff out.
Yeah, bro, I took out the.
Why is vital signs a comp?
Yeah.
Well, acupuncture, yes, it was, when I was a student also, but not vital signs.
Vital signs, it's on there.
Interesting.
Can we see the last couple slides just to like scan, like, I think I missed something. Yeah, we're good. Thank you. I already got it. Miss Bonilla, I already got it. I thought I just missed it. Yeah. I was just making sure that, we're all good.
She's an orange.
It's Friday, okay? I meant to.
You know what she's gonna ask at the during class? Can we go home early?
Every time.
Oh,
Yeah, you know what's sad is that I was thinking, I was like, well, we'll probably let them go early, and I was like, wait, it's their last class.
Yeah,
Unless
he's
you
gonna keep you out to the last minute.
No, when we finish our test, he always lets us.
Yeah, he was
Oh,
late.
Yeah.
So you guys technically
How
are.
many questions are there?
We don't know, but he usually gets something, from the previous.
Okie dokie. So, let's go and get started. So on Tuesday, we talked about, respiratory rate, right? And what else? Let's see if y'all remember.
Pressure. Correct. Temperature.
Temperature, yes.
Rate, BP, heart rate,
And the breathing.
Did we talk about pulse? I didn't think we did.
kind of.
No, we talked about.
There was a pulse.
Blood pressure,
Tachycardia, bradycardia.
temperature, what different types of temperature,
Okay.
breathing.
Okay, so we stopped at, respiration rate. And, we said that healthcare professionals, primarily nurses, when they check for respiration, they check for these three things: the rate, the depth, and then of course our pattern. So remember those three things. And then there's different types of abnormal breathing. We have 5 up here. So just pay attention to the words that they start with. Tachy meaning
Fast.
fast, brady meaning low, dis meaning difficulty breathing. Orthopnea is difficulty breathing unless the patient is either sitting up or standing up. So if they're laying flat, they have trouble breathing.
That was ortho? Yeah.
Orthopnea, yes. And then apnea, A means the absence of, so that's when the patient's not breathing at all. Your breathing has stopped. Okay, pretty easy to remember. So, for tachypnea, the respiratory rates are greater than 20 breaths per minute. And these are all in your textbook. Brady, the respiratory rates are lower than 12 breaths per minute. Those are the only two that have actual numbers. Everyone got it? Alright, we're going to talk about pulse. So our pulse is created by our heart contracting and relaxing, right? When you put your stethoscope in your ear, you hear that love duck sound, that's your pulse. And it's created by our cardiovascular system, which is a closed loop system of vessels. So it starts with the heart, and then everything goes in a circle. And
Test
then
question right there. Closed.
yes. make sure you pay attention to this page. It has the definition of the function of cardiovascular system. So when we measure our pulse, there are several ways to measure it. The more common one is at our radial artery, which is by our, what is it called? Radius. And usually it's counted for 60 seconds. So the three common sites of measurement, we have our radial artery, our brachial artery, which is on the side of our elbow, and then our carotids, which are on the sides of our neck. And then apical pulses, that just refers to when the doctor listens to your pulse with a stethoscope.
Are there any differences between the three in like accuracy?
Not that the book said.
Okay.
So which is the most common one again?
Radial.
Radial.
You said apical.
So yes, apical pulses is referring to when a doctor or whoever uses a stethoscope to listen to your pulse.
Where are the chest?
Yes.
And the radial artery is this one,
It's by your radius.
and the brachial is
By your elbow towards the medial side. And then carotids are on the sides of your neck.
oh, it is
So
the
it-
procedure? Oh,
No, pulse.
pulse.
So if you feel up here by your neck, up here, you can feel your pulse, right? So the carotid artery is most usually used when we perform CPR. Remember we touched the dummy on the neck?
And what's the apical pulse thing?
Apical pulses, someone wanna explain? Younger
Don't
age.
you use the stethoscope
Listening
to
to
listen to the
ears.
pulse?
Oh, with the
Yeah.
With the stethoscope,
Is it usually on the chest, right?
yes.
So if you would hear the whooshing.
Okay, y'all got that, right?
Oh,
Samantha, did you
that
get that on camera?
I read the book. You heard.
So we have the information in the book.
Yes, everything I get is from the book. I don't have special, resources. So, like I said, during CPR, our pulse is typically measured.
Today.
I don't know.
It's
Friday. I'm ready for happy hour.
Where we are?
Don't-
And ready
uh,
for Melanie appearance.
Yeah. I'll leave you out of this.
All right, focus. So, why is it important to check for a pulse during CPR?
The oxygen is switching. Because you want to see if the heart is in action.
Okay, you're on the right track. So, it's important to check for a pulse because that tells us that our heart is pumping. So if you feel for a pulse and you're able to feel something, that tells us that your heart is at least pumping at a rate of 80 millimeters of mercury for your blood pressure. So even though that's kind of weak, at least that tells us it's pumping at that rate. If you don't feel anything, that means there's almost no blood pressure.
But at any of
She
these.
gonna like that.
CPR.
Yes, she is.
So whenever we perform chest compressions, we stop to check what?
The pulse.
The pulse. So if you feel a pulse, that means it's effective, that our chest compressions are working.
I saw all that yesterday.
Where?
What you talking about?
You saw
At
CPR?
Bental?
Uh-huh.
Oh,
Cause somebody passed.
Yikes. Was that an IR?
Like before they started or during?
No, I had just got there from lab, and they woke the guy up, and he just started, boom, like
Crying.
tripping and stuff, and they was like, calm down, it's okay, we just woke you up, it's all right, we're here. And he was throwing his arms up and stuff like that, and I thought he was trying to move over more on the stretcher, so I was like, let me go, put my gloves on, see if they need any help. And next thing you know, I seen the guy put maybe the oxygen or something on him, and he was like, oh, he's not breathing. And I was like, what? Because I looked at his stomach and I didn't see it rising no more. And they caught the cold and everybody came in there.
Wow. And they were not able to revive him?
They performed on him for 43 minutes.
Wow.
Oh, dang, makeup.
River pumping.
Usually
CPR.
they stop after like 15 minutes,
Yeah.
but they went all the way to 43.
Yeah, they gave him like 15 epi's, and he's still.
Wow.
What do you mean by 15 acres?
That's
If
crazy.
they're trying to-
Epinephrine.
Yeah,
That's
they're
what it
trying-
means.
It's
It's like if they're trying to like.
it's like a chemical
Yeah,
jump
something
start.
something may have went wrong during the surgery. Either some sort of medication that they gave him, or
Yeah,
maybe
they,
his
they were
heart
all
failed.
talking about that. They were trying to make sure that the medicine that they gave him, he wasn't alert, or they overdosed. They were trying to make sure that whatever they gave him, it didn't make him overdose. You know, they was talking out loud saying all that
Yeah.
stuff, and I know he had aspirated too as well. So it was just a lot going on this day.
He aspirated during CPR, or
No, it was. I guess it was before. They was talking about that he did aspirate. So
They put him to sleep.
I don't know. They had put him to sleep, and they woke him up. So once they woke him up, he just was like,
Do you think he was feeling it?
you know.
If he
so
woke
I
up
don't
like
know.
that crazy, because
Well, we were done.
Wears out.
We were done with the exam.
Yeah.
They were done. They had just finished.
But
And they
like-
was, you know, they
but,
I guess they woke him up to let him know, hey, we're done. We're about to take you to the room, and I guess he just.
What
But
is
when you're
that?
in anesthesia, it usually starts wearing out little by little. You can't.
That's why
Sounds
there's
like a
so
complication
short
or
versus
something.
the
Yeah.
pregnant
Yeah.
for
Brain
five
damage.
minutes.
It's probably
I felt horrible.
I
But
mean,
that's
usually when patients do wake up from anesthesia, they are kind of confused because they're like, where
Yeah.
am I? What's going on?
They are, and that's how he looked when
They are.
they woke him
Because
up.
they
'cause
don't know
he
where
said-
they are and what's happening. So
Yeah.
kind of gives them like a couple minutes, like, hey, you're in the hospital, everything went great. You know, we're gonna move you to the PACU.
But probably he was moving his hands, so he
Maybe
can't
he was
breathe.
really one because he couldn't breathe.
Maybe he's gasping for
Yeah, he just,
breath.
he just, well, he had started coughing like a lot.
They
So
were
I
probably
don't know.
trying to learn
He
that.
didn't, sorry,
That's been tough.
he didn't announce when he found out.
Okay, Shaheen has an announcement. If she lost her marker.
Yes, last class, last day.
So if anyone finds a right
lost it here?
marker.
Well, you got another
The
one.
right mark.
You
lost it
here at school?
Yes, in Manda.
Oh.
Don't you have another set?
This is from the second. I've
Oh,
already
So
paid.
you didn't
No,
lost
she's
both?
just trying to probably.
No, she only lost the right.
I'm trying to use it.
Okay, alright,
Well,
focus, focus.
Two.
So, the pulse rate
That's
is
not bad.
recorded as beats per minute, BPM, okay? So it's usually counted for 1 minute. Pay attention to these numbers. The normal pulse rate for an adult is 60 to 100. Okay, pulse rate for kids, 10 and under is 70 to 120 beats per minute. And if your resting pulse rate is greater than 100, it's going to be tachycardia. If it's lower than 60, that's considered Brady.
So you need to breathe too short.
Brady
I was
means
just
slow.
simplifying that for myself.
Meaning low, tachy meaning high. Yeah, like Jay's resting heart rate is not
okay.
at 60. It's lower, right?
It's it was 55 earlier.
You can let it die.
Um,
Yes.
Although I will say, like after I got electrocuted, I had SVTs. Those are supraventricular tachycardia. So like the bottom ventricle or the ventricle somewhere just beated abnormally. So it was causing a lot of issues. Like my heart rate looked like they called it hip hop rhythm.
Alright, so a pulse ox. Most of us should be familiar with this. What does it do? It does two things. Measures your pulse and also your oxygen saturation in your arteries.
Why are we always shortening the names?
What do you mean?
Why do you call it pulse ox and not oxygen?
I mean, do you want to go around saying pulse oximeter every single day?
Yeah, but that's the name. It's a meters.
It's how every.
But that's I think the style of America.
Just like
to
we
short
did SC
form.
joints.
This
We didn't
Just
wanna
like we
say
called
the-
it an x-ray.
we didn't
You
wanna say
want
the
to
whole-
say, hey, I'm gonna go take your radiograph today.
It doesn't really matter, if you wanna name it like, name it.
I mean, if you want to call it pulse oximeter, by all means.
If there's a
My
second
life,
digit.
I paid
50 cent is half dollar.
So, the pulse ox measures your hemoglobin.
You have half of them.
And what is your hemoglobin? It's a protein in your red blood cells that carries oxygen from your lungs to the rest of your body. So the pulse ox, what are the two functions?
It measures your hemoglobin.
Oxygen level and the pulse.
In your arteries. Yes.
How like does it even do this? Just
Oh,
like
I'm about to tell you. Okay.
Infrared.
So, it has an infrared light. So when the light goes through, it has a photodetector. What is the, oh, y'all don't know what a photodetector is yet, right? Aaliyah, what does a photodetector do?
So basically, what a photodetector does, it receives the like I don't know how to explain it. Like,
Yeah, it receives the light.
the light, and then
And
it like
then-
reads like the signal, like it's like
Yeah,
a signal.
turns it into a signal that will tell us the number digitally. So it estimates the amount of oxygen in the bloodstream using infrared. Y'all don't need to know that for the exam.
And oh, you said we don't need to know it?
No,
Okay, I was
just know the functions of a pulse ox.
okay.
I'm not gonna ask you
But
how
Miss
it works.
Bonilla, I like that you bring this into this. Like I didn't know it was infrared light.
Yeah, whenever I put stuff on there, I'm curious to know how it works, cause I'm sure somebody's gonna ask me.
So now that you so eloquently transitioned, is it like the infrared or the photodetector catches like the scatter between like oxygen and like the laser, or how does that like
I
actually
think
work?
it measures how the vessels absorb the light.
Okay,
So based on that, it calculates the oxygen.
so the amount of light the detector actually receives as opposed to what's being
Yes.
given out. Okay, cool.
Miss Bonilla, what did you say you want us to know in this slide?
What do we use a pulse ox for? Two things. I'm not gonna ask you how it works.
So pulse and oxygen. Oh.
So for infants, it's slightly different. You don't want to poke their little fingers with the pulse ox. So you use these little devices, a light emitting probe, either on their big toe or their feet, or sometimes you may notice that it on their ear or their forehead, or even their nose.
I've seen it on the earlobe,
I've seen it on the ear, the forehead.
but that's for older people, no? For you?
I saw it on ICP patient.
You can use it on adults, but pulse ox is generally not used on babies.
So that's
Their fingers are way too small.
they attach it to that temporal spot that we scan for the
So-
temperature.
Ma'am, did you mean that pulse oximeter for the children is a light emitting probe?
So the pulse ox is not used for infants and children.
So
They use a light emitting probe.
this
It
is
looks
not a
like
pulse
this.
ox then?
Correct.
Is that because there's no detector on the back of their head?
No, I think it's primarily because the pulse ox is so big and their fingers are so small.
Okay.
We're not gonna read.
So the normal oxygen saturation for a healthy person is 95 to 100.
Adult, ma'am.
Yes. So for adults, factors that might influence the pulse ox reading is if your patient's moving, if the pulse ox is not on there properly, if you have fake acrylic nails that may prevent the light from reading the arteries properly, or if you generally have low blood pressure or poor perfusion to your arteries.
What does that mean?
Perfusion meaning like not enough blood flow to your arteries.
Perfusion blood flow.
Moving on. So, for cardiac arrest, we are going to use our carotid artery to assess, and we're primarily going to check it for 5 seconds, okay, in between CPR. So for CPR, the first thing that you would do is obviously check for a pulse, correct? And then call for help. Hospitals do have different teams that you call for emergencies. Code blue is going to be for cardiac arrest. And then I know that at MD Anderson they had a MERIT team. It stood for Medical Emergency Response Improvement Team. So like if a patient was feeling faint or dizzy or low blood pressure, it's not as serious as a code blue, so you would call the MERIT team.
You would call for that?
MERIT team.
MERIT.
Medical Emergency Response Improvement Team. That's just for you to know, it's not gonna be on the test. Alright, yes.
Can we talk about the difference between palpating someone and palpations? Because I feel like that might get confusing, so.
Oh, palpitation? So palpating someone is, you know, when you're about to perform an x-ray and you palpate their landmarks. Palpitations is when their heart is beating fast,
Irregularly.
irregularly, yes. Blood pressure. So to measure blood pressure, what do we use? Sphygmomanometer. That's a mouthful. And a stethoscope. So there's two types. One is called an aneroid sphygmomanometer, and mercury, which uses the liquid mercury. Remember these for your test. Mercury is considered the gold standard, but this one is more common. This one does not have the mercury.
Is if aneroid is subjective in a sense, like you have to really listen for the.
Yes.
Okay.
Aneroid basically just means the lack of mercury. Yeah, these are not really around as much, but they used to be considered the gold standard.
So now they've switched to more like.
Nowadays, everything is digital.
Digital aneroid.
I don't know if you've noticed, like in the shock rooms, they have that big screen that tells you everything. You just attach the cuff to the patient and it just does everything for you.
It doesn't work if they have arrhythmia.
Arrhythmia?
If they have like a pretty serious arrhythmia, it will not work.
Oh, I did not know that.
It's just gonna keep tightening.
Alright, so what is blood pressure? Well, it is a measurement of the force that's exerted on the arterial walls when the heart is contracting and relaxing. And then, know this, what that means? Coronary cough sounds. It refers to the sounds that you hear when you put your stethoscope in. It's a sound of the blood flow. And blood pressure has two numbers. The top number is called systolic. The bottom number is called diastolic. And what does it represent? Systolic is the maximum pressure the heart exerts while it's beating. So when the heart contracts, that's when we get our systolic pressure. And then diastolic is just the regular pressure when the heart's relaxed.
I remember this with the systolic and contraction. Like when you say C, so it sounds like an S. So I put them both together. I'm not talking
Oh, like contraction, systolic, okay. So, a good analogy that will help you remember is that blood pressure is similar to water flowing through a hose. If there's a lot of water, it's going to increase the pressure, right? If there's less water, the pressure is gonna go down. So similarly, our heart is the pump and our hose is the arteries. Does that make sense?
So is ejection fraction like both of those combined, or is it just the measurement of systolic?
Ejection fraction?
Yeah.
I don't even remember what that means right now. Do you wanna explain?
I'm feeling less confident as this goes on.
What's the difference between arteries and veins?
Direction of the blood.
I'm gonna have one person.
Of,
Jay.
Direction of the blood.
Okay, so what's the difference? Which one?
Arteries are going away from the heart, veins are going towards. Away, A, veins looks like a direction, looks like a arrow.
Okay, Jay, go on.
that's what she was looking for, I suppose.
So, normal blood pressure in a healthy person is 120/80. 120 represents our systolic, 80 represents our diastolic. And how is blood pressure written out? In millimeters of mercury. Hg stands for mercury. So if someone has hypotension, we just look at their diastolic number. If it's less than 60, they would have hypotension. For hypertension, we look at the systolic. If the number is above 140, that would be considered hypertension, and is known as the silent killer, because sometimes people go unchecked for hypertension, and it's more common in men.
Why is it more common in men? Is it
Not
just
taking
genetic or
steroids.
Could be genetics,
Physical.
could be
Maybe.
their
Physiological.
stress
diet.
levels and all that?
So hypertension is basically an increased workload on your heart. It can be caused by being overweight, if it runs in your family, if your diet is very high in salt and cholesterol, and then hypotension, low blood pressure, it can be caused by, like if you're in a state of shock and you lose a lot of blood, that could cause hypotension. If you're severely dehydrated, or if you have an extravasation. Do you guys know what that is? Like for CT, when they're injecting the contrast through your body, but then it goes out of the veins into your skin,
Oh, it's outside.
that's an extravasation. So sometimes, when people are having an anaphylactic reaction, like a severe allergy to something, that could cause hypotension because our arteries dilate. So then our blood pressure drops significantly. Okay?
When there's an allergy, the arteries dilate.
Yeah, when there's a severe allergic reaction, that's called anaphylaxis. So our body's trying to send histamines to the rest of our body. So our arteries dilate.
Do you know that's what it's
The allergic reaction is, you said, what is it called now?
Anaphylaxis.
Anaphylaxis.
Good job.
Okay. So blood pressure is usually taken with the patient sitting upright, and the arm should be somewhere close to the level of the heart. So not by your side, not all the way up here, somewhere around this area. And this is called a what? Sphygmomanometer. It has a bulb that you squeeze to inflate the cuff, and then you use the stethoscope to listen to our brachial artery. Okay? And then blood pressure is measured in what?
Mercury.
Millimeters of mercury. So our brachial artery kind of starts in the middle of our elbow and then goes on the medial side. So if you want to find your brachial artery, please do so. So when you guys practice, you can tell your partner where it is. So from your elbow, go up slightly and then go over medially.
Doing good.
And if you press firmly, you should be able to clearly feel a pulse. It should be very strong.
Should be.
Not
Should
as,
be.
not as strong
Been
as the
too
cat.
relaxed.
I found it there.
Yeah, I can't find it.
Girl,
Maybe the
you're a
jacket.
vampire.
I can't find
Oh,
it.
I
We're
can't
working
find
around
it.
it, so.
I'll help y'all in just a second. So
Wasn't
once
that part of the activity that we're gonna do?
Yeah,
Sphygmomanometer?
Yes. So blood pressure, we place the cuff on our, elbow area, and then we inflate the cuff, correct? So we use our stethoscope to listen to our brachial artery, and, I'll explain this with the video, it'll be easier.
Antecubital?
What did you say?
Antecubital fossa?
Yes.
Where's that at? Is that, okay. That's-
Hey everyone, it's
Aw.
Sarah Richardson.
What about the black streak? Come on now.
Demonstrate how to check a blood pressure manually. First, you'll need to perform hand hygiene and gather your supplies. You'll need a stethoscope and a manual blood pressure cuff. So let's measure a blood pressure manually. To do that, we want to make sure our patient is sitting down with their arm at heart level and their legs are uncrossed. Now they're lying in bed,
that's
we
all
want to
those-
make sure that
So much
this
tension
arm is
there.
at heart level. Then what we're gonna do is we are going to get our stethoscope and our blood pressure cuff. And you wanna make sure you get the right size cuff for your patient's arm, because if you use too big of a cuff or too small of a cuff, it can throw off the reading. And what we're gonna do is we're gonna palpate the brachial artery, because this is the artery we're gonna be listening to get our blood pressure, because we're going to be getting our systolic number, which is that top number, and this is the first sound we hear. And then our diastolic number, which is the bottom number, and this is the point where we no longer hear the sound. So whenever we're looking at the gauge of our blood pressure cuff, we wanna make sure we're really noting those points, because it's gonna tell us our systolic and diastolic number. So what we're gonna do is we're going to put our cuff on our patient, and we want to make sure we find the brachial artery. This is the artery we palpate that we'll be using to determine our blood pressure. And it's found in the bend of the arm. So we're gonna find it, and it is located here. And we're gonna look on our cuff, and our cuff has these arrows. And because this is the left arm, we're gonna make sure that this arrow is pointing in that direction of where that artery is. So you're gonna put the cuff up about 2 inches above the bend of the arm. First, what we want to do is we want to estimate the systolic pressure. So we want to find that number. To do that, we're going to palpate the brachial artery, and we're going to inflate the cuff until I no longer feel the brachial artery. And at that point, when I no longer feel it, I need to make sure I'm looking at this gauge to know that number, because that number is our estimated systolic pressure number. Then when I go to take the blood pressure, I'm going to inflate the cuff 30 millimeters of mercury more than that estimated number. Now the whole reason for doing that is because we want to avoid missing the oscillatory gap that can occur in some patients. Not all patients have it, but some. And it's usually patients with hypertension. Because the oscillatory gap is like this abnormal silence that can occur, and it will throw off whenever you actually hear that first sound, which is your systolic number. So I'm inflating the cuff while feeling on the artery, and I'm gonna note the point where I no longer feel the artery, which is about at the 100. Then I'm going to deflate it completely and wait about 30 to 60 seconds, and then we'll take the blood pressure. So our estimated systolic number is 100. Now I'm going to inflate the cuff to 130, and that will avoid missing the oscillatory gap if one was present. So I'm going to take my stethoscope, put it in my ears. You can use the bell or the diaphragm of your stethoscope. I like to use the bell because it's best at picking up low pitch noises. So we're going to place that over the brachial artery. Do it lightly, don't fully compress it because you can occlude the artery. Then we're going to inflate our cuff to 130 millimeters of mercury. And we're going to let it fall about 2 millimeters of mercury per second. And we're listening for that first sound, which is our systolic number. once you have your reading, make sure you fully deflate the cuff full of air, and you're gonna take the cuff off of your paper.
Why do you think the thing is going like this?
So, time to practice.
The first part she should do first.
When this is where the
So, yes.
That's whenever that's
This is where the
So, see the.
That's just a little
dial,
confusing.
You see the numbers start to jump like that. Don't worry, it's normal. Just wait for you to hear it.
So we have 4 stethoscopes, so maybe y'all can get into 4 groups.
Dibs? Question mark?
Yes.
Okay.
You have two more right there, Miss Bonilla.
We have 1 stethoscope, so 5.
Yeah, you have one more right there.